Welcome to the first edition of the Kids and COVID Conversation Series. I'm Bruce Lesley, President of First Focus on Children, an organization dedicated to making children and families a priority in federal policy and budget decisions. Today we begin a series of conversations about the dual crises of the coronavirus pandemic, the economic crisis, and also kind of all the ramifications of that for kids and how they'll be affected even as Washington ignores them. Today we talk about child abuse in the time of COVID-19 and difficulties that come with staying safe at home while staying at home isn't safe. To that end, we are honored to welcome a terrific panel of experts from the child welfare community and who will help us explain how kids are dealing with this crisis during the pandemic and what we can do about it. First, from Children's National Hospital Medical Center, we have Dr. Allison Jackson. We're also pleased to have Kate Murphy from Texans Care for Children, along with Cathy Palm from the Center for Children's Justice, and our own resident expert, Aubrey Edwards-Luce, Senior Director, Child Welfare and Juvenile Justice Policy here at First Focus on Children. Thank you all for being here today.
Thanks for having us, Bruce.
Thank you.
Glad to be here. Yeah, good to be here.
Thank you. So, Aubrey, let's start with you, and hopefully you can help lay the groundwork for our conversation today. So tell us about, what is the definition of child abuse, and why is this all the more relevant during this crisis?
Yeah. So one of the things that's important to understand about the definition of child abuse, there's a federal definition that can be found in a very important piece of federal legislation called CAPTA. And then we also have a number of state definitions, all 50 of them, right, have different definitions of what that is. But some of the key ingredients of a definition of child abuse is that there has to be an involvement of a parent or child caregiver. There has to be an act or a failure to act, and it has to lead to an imminent or serious harm or risk of harm. So when we talk about abuse, typically you'll see in different child welfare agencies across all the states is that they'll talk about it in terms of physical abuse, sexual abuse. There are also 15 states that have formally adopted a definition of child sex trafficking that also is included in sexual abuse as well. And all of this is important because, while the COVID pandemic has been happening, children have been spending a lot more time in their homes, which gives them an opportunity to, do more bonding, do more family activities. But it also means that they're spending a lot more time with their family members. And for children who have been abused physically or sexually, it doesn't give them an opportunity to then have that abuse to be discovered or spoken to with somebody outside of the home because of the quarantining. So that's kind of the framework and why it's important to have this conversation today to talk about what impact quarantining has had on child abuse.
Thank you, Aubrey. Kate, let's move to you. What is the scope of this problem? In an average year, how many children will be abused?
Well, nationally, about 600 to 700,000 children experience maltreatment every year. Confirmed have a confirmed experience of maltreatment every year. About 10% of those kids live in Texas. We have about 67,000, a little north of 67,000 confirmed victims of abuse or neglect every year here in this state. And then there are about 400,000, a little north of 400,000 that wind up in foster care nationally, about 50,000 in Texas who wind up in foster care after we've confirmed that they've experienced maltreatment.
Thank you. Cathy, I want to ask you, how has the pandemic had an impact on these numbers, and how has this changed the reality for children?
Well, I think we don't know much at the moment. What we do know is that calls to child abuse hotlines are significantly down, whether it's in Pennsylvania or across the country. but we, so that makes sense based on what Aubrey said, that children aren't going to childcare, they're potentially not having pediatric healthcare visits, going to school. But to what degree that means there's also actually a correlation to injury or harm to kids, we're not yet there in terms of knowing that information. What we do know, this morning I was on a call with child abuse pediatricians from across Pennsylvania, and one of the things that they said, to your point, Bruce, when you opened up, you talked about kind of the concurring crises, but there was also another epidemic and crisis we were in the midst of when this all hit, and that was the opiate, or I'll put broader drug crisis. And so one of the things that we're seeing in some of our communities is not as much physical injury that's coming into hospital settings, but ingestions that are coming in. I think that's one of the things that we've kind of lost sight of, is kids are in their homes and they're not playing on playgrounds now. They're creating playgrounds in their own homes. They're on things. So things that child safety around medicines and other things that won't necessarily fit into a neat child abuse category are really a child safety issue that may be going as unnoticed and unaddressed as well during these times.
Thank you. Dr. Jackson, what changes are you and your colleagues seeing regarding the frequency and the types of abuse during the pandemic at Children's National?
So at Children's National, we have experienced a significant drop in the number of children referred to us or who come on an outpatient basis for evaluations when there is a concern. And I think the leading driver of that is what was already mentioned, the decrease in number of reporting from mandated reporters like schools, child care professionals, which are, I would say, the leading source of referrals to child welfare agencies. And those child welfare agencies are also the leading source of referrals for medical evaluations when there is an abuse concern. And so as a result, we are seeing less. Having said that, the things that we are seeing are somewhat troubling. And I think that it is premature to say that this is going to be kind of universal across the country, because I think there are varying experiences in different geographic regions. However, we have had a significant increase in the number of children who are hospitalized with concerns for child abuse. And so, whereas during the same time period last year, we had about 40% of children hospitalized with injuries related to physical abuse. This year, during that same time frame, and this is kind of after March when the shutdown began here, 60% of the kids being evaluated for physical abuse required hospitalization. And so overall, what that translates to for us is kind of an increase in morbidity and in some cases, increase in mortality during this time frame. I would also say around the issue of sexual abuse is that we are seeing again, fewer children overall referred. And of course, children have to be in a place to share with a trusted adult what has happened to them. And, schools tend to be those places, or maybe even their pediatrician might be a venue where they feel that they can disclose or where they are even asked that information. And since sexual abuse is committed most commonly by someone close to the child or within the family, it makes sense that the opportunities to kind of reveal that information have significantly been reduced under the current circumstances related to the pandemic. And so while we are seeing fewer children for sexual abuse, of the children that we are seeing, more of them are having clear findings. And what I mean by that, and again, I'm speaking from a medical perspective, but clear findings as it relates to a consistent and clear disclosure around their sexual abuse. The percentage of those kids is significantly greater than, and I'm not saying statistically greater, because we haven't done statistical analysis, but percentage-wise, we're seeing a significant difference from this time last year to the present. So all of this to say that I think children being confined in the home adds to the risk for potential harm, because the perpetrators or offenders of child abuse are more commonly those very people with whom they live. And the level of stress that families are under these circumstances is astronomical, frankly, at this point. I think the other important thing to note, and maybe this relates to what was said previously regarding exposure to illicit substances, maybe a supervisional issue because children are home. Also related to that is that kids are online a lot for basically everything, which also increases the opportunity for internet enticement of those children, which can result in kind of sexual abuse by way of the internet. Yet another risk under these current circumstances. I will say on a positive note, some of my colleagues have commented across the country that they are not seeing more physical abuse, and that maybe because there are more caregivers at home that that actually in some cases may be protective for some children.
Thank you. Aubrey, do you have anything to add?
I just wanted to add that I think that the information that Dr. Jackson's giving us is really important, because as child welfare advocates, when we talk about this kind of high level data that like child abuse numbers, we're concerned that child abuse numbers are going up writ large. I think it's important to remember that there's different types of abuse and kind of different etiologies and how they happen and who they're most likely to be perpetrated by. And even as Dr. Jackson was just speaking about not seeing as many injuries, we know that children under the age of 1 are oftentimes the very, very high risk of experiencing child abuse. But those incidences are often because of not having like the type of supervision or support. So either supervision for neglect or support for the parent in making sure that, when you're asleep, you don't have enough sleep and or you don't have other folks to support you. Sometimes parents can feel overwhelmed, and that can lead to instances of abuse. But as Dr. Jackson was just sharing, having more parents or more adults in the home to be able to take care of the child may actually be a situation or environment that is being a protective factor from abuse. So I just think that it's important as we're having these conversations at the policy level to remember that there are different types of abuse, different kinds of protective factors, different kinds of risk factors that we have to take into account.
Dr. Jackson, one of the things I wanted to ask you is I remember during the Great Recession, there was evidence coming from children's hospitals that through the mortgage foreclosure crisis, there's, needless to say, huge stress is being put on families. And so consequently, in some areas, there was some reports of higher incidences of head trauma cases and things like that. So that was 10 years ago, and now we're in a period where we have both COVID and what all of us are talking about, but we kind of simultaneously now have this economic crisis too. Can you speak to that and kind of what kinds of things should we be thinking about in terms of really supporting families through both sort of a COVID and simultaneously an economic crisis?
Sure. Yeah, that was research led by Rachel Berger at Pittsburgh Children's Hospital around the increase in abusive head trauma during that period of the economic crisis. And again, abusive head trauma more commonly affects younger children, infants primarily. And those are kids who are often at home. I think if we extrapolate that out to children across the age spectrum, now also confined to home, it really does paint a picture of vulnerability for children to be subject to all forms of abuse, frankly, this is extraordinarily stressful to be kind of trapped at home with a very good reason. I am a stay-at-home advocate, especially as an African-American woman, knowing the risk of COVID to my own health and the health of my family members. So I know that it's the right thing to do. But having said that, people are really, truly trapped at home and have been trapped at home, and not to have an outlet, and to be very frustrated with kids who might be dysregulated because their routines are off and they miss their friends. And, it's not just the itty bitties that are vulnerable. It's the older kids too, who can be subjected to emotional abuse by, name calling and that kind of thing. So I think we just have to be supportive of families, to acknowledge the difficulty of the circumstances that we all find ourselves in, and for professionals who interface with families to reach out to check on them, to see how they are doing and to ask if they need any help.
Turning to some of the kind of data and the changes in the data, let's start with Kate and then Cathy. Can you guys talk about the reports? How are the reports of child abuse and neglect changing during the COVID crisis?
So in Texas, we're definitely seeing a decrease in reports coming in. I think we've had about a 50% decrease in reports of child abuse and neglect coming in. But if you look at the data, at least for March and April, I don't have the data for May and June yet, but if you look at the data for March and April, even though our reports were way down, our removals were about the same. So the number of kids who are being removed and placed in foster care were about the same as they were back in February, January, December, November, for several months leading up to this. And what I've been hearing from some judges around the state and from some of our hospitals and local providers is that a lot of the cases that are coming in are more severe cases. We're seeing more severe injuries in children. We're seeing more severe physical abuse. We've also had an increase in, at least what looks to be an early increase in child fatalities, particularly in the DFW area. Our hospitals there have seen more kids come in for serious injuries and then pass away. And there was also a significant report that came out I think it was last week. It was last week in the federal lawsuit against the Texas foster care system that highlighted some ongoing problems, but some problems that were very serious during the pandemic, including the details of a couple of deaths that have happened of children in foster care here in Texas. One who was with a kinship caregiver and one who was in an emergency shelter. So even though reports of abuse and neglect are down, we're definitely seeing still some very severe instances of abuse and neglect in Texas. And we're also seeing that not only in bio homes, but also within our foster care system itself.
Cathy, do you want to add to that?
Yeah, I think, again, I would echo that. We have seen overall a reduction, both in terms of the cases that get coded as a child abuse and require an investigation, as well as those that in Pennsylvania are referred to as general protective services. So it doesn't meet the statutory definition of child abuse, but there's obviously concerns about a child. That's kind of our bucket of neglect cases. if you talk to children and youth workers, even though the reports are down, what they say is a common denominator is substance use to the reports that they're responding to. Injuries are more extensive where their injuries are happening. One of the challenges here in Pennsylvania is that domestic violence. So if police or a neighbor or someone contacts about a domestic violence incident, that falls into our general protective services bucket. And so those don't automatically get to child abuse pediatricians like Dr. Jackson. Dr. Berger was mentioned, who is here with us in Pennsylvania. And so we are concerned about the degree to which there could be injuries, there could be things that are happening for kids of all ages that potentially without that connector tissue to kind of that medical child abuse pediatrician, or even just a general healthcare practitioner, you may be missing things. The other thing we've had a couple reports of is a rise in attempted suicides of young people. Some inside our foster care system and some inside of their own biological families. But we have seen, some of the reports that have come in have involved a young person who attempted suicide. And I think in general, we're all concerned about that. To Dr. Jackson's point, one of the things we've been trying to do in Pennsylvania is not look just at the child abuse data, but look at ICD codes from hospitals, but also our partners in victim services. And so on a national level, RAIN, which is essentially the network where people call for sexual violence, our partners there will tell us that for the first time since that hotline was created in the month of March into April, the majority of calls came from minors, and minors who were saying, I'm at home, I'm living with my perpetrator. And I think that's one of the challenges too, is we often think of sexual abuse as adult onto child, but a good percentage of children who are sexually assaulted by another youth. And so that is one of the challenges too that could be happening, is not just that you're in a home where it's an adult, but what if it's your extended family? What if it's your brother? So those are the types of things that I think we are worried about. I think there's been a reasonable conversation nationally about, let's not be too alarmist about the number of child abuse reports going down, just because so many families do get reported to a children youth agency or a child welfare hotline for things that are more social determinants of health and poverty related and things like that. But I would say those of us who also work on the victim services side are not being alarmist in the fact that we have seen significant troubling sexual victimization and physical victimization that has happened to kids since March 1st of this year here in Pennsylvania. So we're trying to be smart about not being too alarmist about the overall numbers being down, but also reinforcing to people that there is real threat for some kids inside of the situations they're living in right now.
So I think one of the things that I am taking from this is that from all of you is that particularly in this time, we've really got to look at a lot of different data sources and information about how kids are being impacted. In some ways, because kids are hidden, it's some of the data is unclear, and so looking across different indicators. And so, Cathy, staying with you on that, what other indicators of child safety are changing during this pandemic? And you've outlined a few here. Are there other things we should be really paying attention to?
Well, I think the other thing that is worthwhile to talk about is different than like the recession of 2008, where potentially you didn't have, the one silver lining to this being such a dramatic new experience in our life is that people have mobilized. And so like here in Pennsylvania, we've seen a couple of the universities, Penn State, University of Pittsburgh, that have really pretty quickly mobilized into family strengthening surveys. So it's kind of like real-time conversations with families. What's going on in your family? What's your biggest concern this week? And things like that. So in some ways, that's giving us kind of a pulse on the context of what's going on for families. What's got you most concerned this week? And based on what we're hearing is the biggest concern, how do we mobilize differently? How do we think differently? But I do think in all times we have to look at, we're seeing a significant uptick in poison ingestion and calls to poison control centers. So from our spectrum in Pennsylvania, we've been keeping what we're calling, the serious, critical, and fatal incidences that have happened for kids since March 1st. And we're looking at cases where there's criminal charges involving a crime against a child. We're looking at poisonings, overdoses, as well as fatalities, near fatalities, those types of things. We have a tendency to think of child protection as child welfare. And so we look at what the child abuse numbers are, but we know that both what gets reported, what gets substantiated, there can be a whole lot of room for improvement on that. And there can be a whole lot of bias built into that. So if we're not looking at Dr. Jackson's numbers around hospitals and ICD codes, if we're not looking at rape crisis line items, if we're not looking at children's advocacy centers, we're not necessarily capturing a full picture of what might be happening for kids right now.
Yeah, I appreciate that. And so Kate, just wanted to ask you kind of, how do systemic and structural issues play into the changes we're seeing right now?
Yeah, I think one of the things that's been really evident throughout the pandemic is that a lot of what we're seeing is nothing new. It's just exaggerated. I think a lot of the challenges that we've seen, and a lot of the trends and patterns, whether it's on the front end in investigating abuse or neglect and bringing kids into foster care, or making sure that kids are safe while they're in foster care, it's all stuff that has been an ongoing challenge that is even harder when we can't as easily go in person to check on kids, when it's harder to go be physically present and make sure that kids are really safe. And there's a lot that can be, I think, concealed or hidden or covered up when you're doing things virtually. So I think, a lot, and I know Cathy touched on this a little bit, but another thing that I'm wanting to dig in a lot more on, since in Texas at least, we're seeing reports down, but removals stay relatively even, is implicit bias in reporting and in that whole early process. That's something that we've always known as an issue. It's something that I think we really should be digging into a little bit more deeply. But I think everything just is kind of extra right now, if that makes sense. So I think for me, one of the things that's been on my mind a lot has been the stuff that has been highlighted in the foster care lawsuit. There's been a lot about challenges in how we do investigations, on how we check on kids, on how we make sure they're safe, and what caseworkers are doing, and what the role is, and what it looks like, and how we go about that, and whether we have people really doing their job and really checking in to make sure that kids are okay, or if they're kind of brushing things off or downgrading things that come in. And then I think there are also some things that have changed with the pandemic that have been positive. One of the things that I've heard a lot from our courts is that we're seeing people come into court a lot more prepared. We're seeing a lot more interaction with the kid in placement, which is giving judges a better sense of what their life is really like and giving them a better understanding in some situations of things that they've maybe heard about before, but can really see and experience and understand in a new way now that they are getting to see the kids at home in a virtual courtroom setting. So I think, when you're looking at some of the systemic and structural issues, it's either exaggerating something that's already a problem, or we're seeing things that can be that have gotten a little bit better, and I think can continue after this, right? I know one of the things that I've felt listening to lawyers and judges talk about how much more prepared they are coming into court and how much easier the docketing system is when they're doing everything virtually, as opposed to the more traditional way we do it in Texas is, well, why did it take this for us to be prepared to talk about what's going on with our kids in court? Like that shouldn't have been the case. And I feel like it's really highlighted the need for people to continue some of the things and continue some of the practices that they've started because they've had to with the pandemic. So it's a little bit of a mixed bag on that.
Yeah. Aubrey, do you have any thoughts on kind of the systemic and structural issues at play that you want to add to this discussion?
And I would maybe just like dig in and unpack a little bit of what Kate was talking about with regards to the implicit bias. So the way that children get involved in the child welfare system, for folks who maybe aren't as clear on that, is oftentimes it's somebody, and most frequently it's police or hospital or education staff. Those are kind of the big three reporters of child abuse. They call the state child welfare agency's hotline and say, I think this child is being abused. And then once there's been enough data, acquired to say that this is a real child and that there's a location that we can go to and try to see this child, the child welfare agency will then send out a social worker to go and look at the child and talk to the family and try to get an understanding of what those concerns were and whether the allegation of abuse is founded or not. And so when Kate's talking about the implicit bias in reporting, I think Texas's data shows something that's really, really interesting and that kind of bears out at the national level. Chapin Hall has had some data about how 85% of reports that are made about children being abused are usually dismissed and not found to actually be true abuse or neglect. And so when we have the call volume, so the reporting level is dropped, but the number of actual cases being found to be abuse or neglect are staying the same, and children are being removed because of those concerns, then I think what we're seeing is that there's something that's happening at the reporting level that is now somehow getting changed for the better, in terms of now there aren't as many children and families who are having to go through the experience of being investigated by the child welfare system for no reason, right? So they're getting more accurate in terms of who they're deploying those services to, which is important, I think, for policymakers to think about, for legislators to think about, the benefit of making sure that implicit bias or any other measures that need to be taken in order to make that process more accurate. It's going to save the system more money and more resources. It's also going to prevent the trauma of having to be interrogated through the investigation process. But I think it also highlights the need for better training for mandated reporters. Right now, children aren't in schools and they're not going to their hospitals as much. So there's fewer doctors and education staff who have opportunity to really make those reporting calls. But if and when schools do go back into session and more of the quarantine measures are lifted, we want to make sure that our mandated reporters in those two settings are able to have the training that they need so that we can stay at this level of accuracy with regards to reporting, if not improve it even greater.
Dr. Jackson, I wanted to ask you, now when I used to work for the children's hospitals as well, and one of the things I learned from Children's National was sort of this whole issue of, in some ways, some of the patients that you all see are the effects of system failure, in other systems. So, on this issue of systemic and structural issues at play, would you like to speak to that? And also, other issues that around education and training that come to play here.
Sure. I think the role of historical trauma is not to be minimized, and as a institutional or system-based dilemma that we find, or dare I say curse, that we have passed on from generation to generation. I think, what we know about childhood adversity is that it affects health and well-being, and the role of historical trauma, whether it be in immigrant populations, whether it be in Native American populations or in the African American community, the role of historical trauma, and really kind of the persistence of race-based and culturally based trauma certainly is an adversity that can affect health and does affect health and well-being. And so, to deny that somehow intersects with child welfare and trauma as it relates to abuse and neglect, I think, we'd be kidding ourselves that there was no real intersection in that. And so I think a level of cultural humility really needs to be embedded in the systems that respond to children and families. And that extends to those who are mandated to report suspicions for abuse and neglect. I would say on the point of education is that I've been really struck by the number of not only healthcare professionals, but also social work professionals and other mental health professionals on kind of the dearth of education and training that they have received in their early, pre-career, in their secondary or rather college or graduate school level education around the issues of childhood trauma and the consequences of that. And so I really think that in order for a system to be able to respond appropriately, we have to have the knowledge in order to do that, and the cultural humility to do it in a way that is supportive and beneficial to children and families.
Thank you. Cathy, I know, every time I talk to you, I learn a ton of stuff about this entire issue, but also, you really think very deeply about sort of these structural issues. And so, yeah, I'd love to hear your thoughts on this issue too, sort of the systemic and structural issues that are in play here.
I was just sitting here thinking how interesting and how Bruce and Aubrey First Focus should really kind of take a bow, because folks won't understand this, but we had a convening this past fall, and you really spent a significant amount of time talking about racism and the systemic issues around equity, and then also the front end of child welfare. From the Center for Children's Justice, we really do have always, every day, it's about what's the front end look like? Who's making the calls? What's the level of training for mandated reporters? How are you screening report? To what degree are we filled with bias? And when the call comes in and the response to that, we are troubled by the number of children who sit and wait in foster care. But we also think if we only stay focused on how we do better by those children who are already there, we've missed this grand opportunity. And I think that's what's fundamental about this experience right now, that's unexpected, is, 6 months ago, to talk about the front end of child welfare, mandated reporting, screening, triaging at the hotline, people's eyes glazed over, like, oh my gosh, like, why does this matter? This isn't the big stuff. This isn't the 4E. This isn't the foster care. But from our perspective, there's where we fundamentally, if we want a public health approach, if we really want to strengthen families, it really is about what happens before the child welfare door ever opens. We particularly think about this in terms of infants with substance exposure. you know, the reason nobody calls, the reason moms don't disclose they might have used drugs during pregnancy is because the call is going to be made to a child welfare agency. It's not being called to a public health nurse. It's not being called to someone who's in recovery, who's going to help them think through what it's like to both live in recovery or stay in recovery and have a newborn. So I'm hopeful that this horrible experience we're living through COVID-19, to Aubrey's point, has opened our eyes wide open to say, we can't go back, because everything that wasn't great before has been 1,000 times worse. And we owe it to ourselves to say, we will do better. We will do better in so many ways. So, you know, really honestly, I say to you guys, like, I'm just thinking about it, the racism, the systemic issues, the front end. You guys were talking about this 6-7 months ago, and I kudos to you, because I think it really has set us up to have a better conversation today when we needed it.
Right. So, you know, I would be remiss if, as an organization working on policy, if we didn't really turn to that. And I would really love to hear from all four of you on this issue of, okay, so we've got these issues, and so what policy changes are necessary to prevent abuse during the pandemic and during the age of social distancing? But also, you know, one of the things people are not thinking about is there's been sort of this whole focus on COVID, but we're also in the middle of an economic recession. And so what kinds of things would be really helpful? And I think one of the things, you know, I'll start with Kate on that. Kate, you know, any thoughts you have? And, you know, I know that, you know, I'll tell the viewers something real quick, is that we all work together on a letter around this. And one of the great things I think that, as you know, both the state groups and the national groups working on child welfare policy, is that, you know, I'm pleased that we all kind of thought about the bigger, broader implications. When you think about child welfare, it's the whole kid, right? So we talked about health and education. And so, you know, we could really get into this, could be like a 3-hour conversation, but if you had some sort of top policy changes that you think we really need to think about and implement both at the federal and state level, you know, go ahead, and we'd love to hear those.
Yeah, I think a lot of what we are focusing on right now really ties back to how Texas is going to implement the Family First Act, and what all maybe could be. I know federally there have been some conversations about expanding what prevention services could be used for through Family First. I think that's a really important part of the conversation at the federal level. But I think for me, on our work focuses a lot more on state level advocacy. It's how are we going to keep more kids safely at home and support their family unit? How are we going to do that in a really thoughtful way that is that takes into account some of these things that we've been talking about? You know, like Travis County, just as an example here, our number one reporter to child welfare is not educators and it's not medical professionals. Here in Travis County, it's law enforcement. And we know that Black children are 4 times more likely to be reported. They're 6 times more likely to be investigated, and they're 8 times more likely to wind up being removed and placed in foster care. We also know that once they're in foster care, they are overrepresented at every stage. They wind up staying in foster care longer. They're less likely to be reunified. They're more likely to have negative outcomes. And so I think, you know, one of the things that we're really focusing on is how do we keep more kids out of foster care? How do we keep more kids who are in foster care safe? And how do we reduce some of the racism that we see throughout our foster care system in the process of doing that? So a lot of the things that we're really focused on are, one, protecting our budget, protecting our child welfare budget. Texas has made a lot of investments in its child welfare system over the last 4 years. And we're right now facing 5% budget cuts, and we're expecting to see additional cuts asked for later. So anything that can help keep the state afloat and keep those investments on kids and keep the conversation around kids is something we're really focused on, and talking about how we can really do a better job of supporting children and families all the time, whether it's in a crisis or not. You know, and like you said, we could probably talk about this ad nauseum forever, but a lot of the things that we're talking about in terms of child welfare specifically are smart ways for Texas to implement Family First, to provide better support to pregnant parents and youth in foster care, to provide better support to parents with substance use disorders, with mental illness, so we can really wrap around those families and take better care of them, protecting existing services from funding cuts, and then we also have a focus on increasing oversight for kids in foster care and making sure that we're really having making sure those kids are safe. Like I said, we had a big report come out that just highlighted all of the really long-term serious problems with abuse and neglect within the Texas foster care system itself. And so increasing that oversight is a really important thing for us right now too.
Thank you. Dr. Jackson, I want to turn to you on this issue too. What are some of the issues that, you know, from a policy perspective that we need to be thinking about? And, you know, I really want to highlight a couple of things Kate said, you know, the issues of states are going to have fiscal problems, including DC. And so at the very time that we actually need more resources and supports for kids, we're actually potentially going to see huge budget cuts, and you know, so that's one thing. But any other things that you want to speak to there?
Sure. Well, you know, I as a physician have to speak strongly for healthcare and access to affordable healthcare, to include bolstering and ensuring that there are no deficiencies for Medicaid populations, which children's hospitals happen to rely heavily on, because they often are a safety net, in addition to providing that very high level specialty care. They often are a safety net for communities. And so ensuring a robust healthcare system is critical, knowing that adversities of, you know, a variety of adversities affect health and well-being. And so you need to have a health system that has the resources to be able to meet the needs. I think, you know, as a public health person, looking at prevention from the 3 levels of primary, secondary, and tertiary prevention, I think really is what needs to be supported through policy. And, you know, primary prevention can be in many ways universal. You know, how do we make better choices for children to prevent sexual abuse from happening, and programs like Stewards of Children as a primary prevention for child sexual abuse. You know, how do we expand the reach of programs like that so that parents and families can make safer choices and the burden is not all on the child to protect themselves? You know, how do we support parents who have had their own childhood histories of trauma or domestic violence that can then impact their own parenting or their own children? How do we support them and meet their needs in a way that allows them to be the best parents that they can be? So there's the primary prevention, and then secondary and tertiary prevention really are, you know, how do you, one, recognize things early before they get to be worst case scenario? And then how do you intervene and support and restore well-being within a family unit once abuse or neglect has occurred? And, you know, from poverty to education to diversity, equity, and inclusion. I think like all of those things are very relevant policy issues that dovetail into the world of child welfare.
Yeah, that really speaks to this, to the whole child nature of addressing this this issue. And so with that, I want to turn to Cathy and then Aubrey to sort of close it out. What policy things, Cathy, would you, kind of top, I know you would have 12 pages of policy. But we could talk about a few that you think would be really important for our viewers.
Well, I do think one of the things that's really interesting, again, I don't know the national data, but in Pennsylvania, a significant trigger to children entering the child welfare system coming into contact is really in housing stability. So one of the things I've wondered is part of the reason we've had less calls to the child line is in the state of Pennsylvania, we've had a moratorium on all evictions. And so people, for the moment, are temporarily safe inside the home that they're in. So I think this crisis has reminded us that we have to think of it from a broader perspective, a public health perspective, a social determinants, and not just use those words, but actually do it. To that end, I think we need to look at CAPTA. CAPTA is a beautiful roadmap, but it's not well funded. But at the same point in time, even the Family First Prevention Services, the bucket of what we consider prevention is so small. Important things, substance abuse, mental health, but what about domestic violence? What about housing and physical security? Those are the things we know stress parents out. Those are the things that are the cascading effects for families. So both in these extraordinary times we're in and the ordinary times, we really have to look and say, do we have the right tools in our toolbox for prevention and family support? And I would argue we don't. And it's time for Congress to be open to that and really think about it. But not just Congress, states. I mean, sometimes we fund things and we funded them for so many years. We just keep funding them because we funded them for so many years. And we should challenge ourselves to say, are we funding the right things and do we have the right tools in the toolbox?
Well said. Well said. Aubrey, any kind of last thoughts on this whole policy discussion?
Yeah, I mean, I think I want to talk about policies and also just approach, right? So I think everything that everybody said right on, and I agree with. I think one of the things that's complicated about this is that when we think about preventing kids from coming into foster care, we think so much about systems that we forget about the child. And we forget about how complicated the lives of children in foster care are, the lives of children are before they enter into foster care. So when we're thinking about prevention, I think Cathy is 100% right. There are so many things that kind of are drivers to getting kids into the foster care system that our Family First Prevention Services Act has not allowed for states to pull down extra funding in order to address some of those drivers. And part of the reason I think for that is that those reasons are complicated, right? Like these are children with complicated lives who are living at the intersection of substance abuse and domestic violence and economic insecurity. And when you want to try to find an evidence-based practice that covers that and also in a culturally competent way, you don't have a whole lot of options there. And so when we're thinking through wanting to make sure that we're using the tools in our toolbox that are both best effective, there are a lack of tools that kind of allow us to get at these intersections. And so I think that's both like a research priority, but it's also just a framework change that the child welfare system needs in general, and not just on the prevention side of things, but also for the treatment side of things. Before I joined First Focus, I was a guardian ad litem and policy attorney at Children's Law Center. So I was working, on the ground with youth who were in these intersections, who had risks for child sex trafficking, had been sexually abused, also had a substance abuse issue, or they'd had multiple types of different types of abuse, and there's certain modalities and treatments that you that are really only meant for children who have experienced one type of trauma. And so we need to be thinking about developing tools that allow us to help children who are living in all of these different intersecting adverse childhood experiences. And until we do that, I think that we're going to be piecemealing things together and always trying to keep up with all of the hardships that our kiddos have experienced. So I think that's one of the things that we need to be thinking about in terms of framework, is not focusing so much on, we've got this hammer, so let's apply this hammer to the situation that's very complicated. We need to be thinking about these interconnected issues, and make sure that we use an interdisciplinary approach and response to addressing the needs of these families and children that we're wanting to make sure stay out of our child welfare system or are able to exit it into security and prosperity. So that would be my addition.
Yeah, no, thank you. So I know we're running. We've talked an hour about this, and we could talk for much longer because we know that it really does affect the whole child. These conversations, and we haven't even gotten into sort of their education and other issues that are all affected through this whole crisis. And so those will be things that we'll be exploring in future chats around COVID. But I really want to thank you all for being here today. We have a great set of experts. So just shout outs to Dr. Allison Jackson with Children's National, Kate Murphy, Texans Care for Children, Cathy Palm with the Center for Children's Justice, and our own Aubrey Edwards-Luce with First Focus on Children. I think that you guys have really shared a lot of enlightening thoughts about sort of the intersection between the child welfare system, COVID, and also the economic recession, and things that we need to address as a country and in states and local localities. So thank you all for your time today and for the work you do each and every day for our kids and keeping them safe. And thank you all for joining us today, both either on YouTube or Facebook. I hope you will continue the conversation in the comment section and with your own networks. We will keep the conversation going about how the pandemic is affecting children. Be sure to join us for our next Kids and COVID conversation. Stay tuned to our social media channels for the next topic and how you can join us. And also, please reach out to any of us on social media or through our organizations if you have thoughts, comments, or any ideas that we should be really thinking about. I would also point to a resource. A number of us working together did a letter, for example, to Capitol Hill had 12 pages of recommendations on things that we think that Congress should address with respect to COVID and the child welfare system. But there's probably more things that we probably should have had in that, and also there's very unique things at the state level. So anyway, I want to thank you all again, and we'll see you all soon. Thanks.
Thank you.
Thank you.
Thank you.